call Stuart McMillan to be followed by Anna Sarwar.
Thank you very much, Presiding Officer. Presiding Officer, just at the very outset, I think for Annie Wells's benefit, there are more GPs in Scotland in comparison to England and Wales. There are more hospital consultants in Scotland in comparison to England and Wales. And there are more qualified nurses and midwives in Scotland in comparison to England and Wales.
Would Stuart McMillan take an intervention?
Okay.
Emma Harper.
Thank you for taking that intervention. And I know you're sitting beside me. I would just like to ask Stuart McMillan if he agrees that Brexit is not helping when we're seeing a 90% reduction in nurses and midwives registering from the EU.
Stuart McMillan.
Unsurprisingly, Emma Harper is absolutely correct with that point. And I mean, some people might actually want to laugh at it, but unfortunately, Brexit is going to have a negative effect upon, many aspects of society in Scotland, including the NHS.
Miles Briggs.
Then, why did the former Health Secretary, the now First Minister, cut the number of student nurses and midwife places when she was Health Secretary?
Stuart McMillan.
Mr Briggs, this Scottish Government, this SNP Scottish Government, has actually increased their numbers each year for the last 8 years. So I think Mr Briggs needs to do a bit more homework. Presiding Officer, not one person in this chamber could actually stand up in this chamber and say that the NHS is perfect. Not one person in this chamber could stand up and actually highlight that any organisation is perfect. And if they do, then they're lying. The NHS does have its challenges, but it's also a magnificent organisation that delivers, it saves, and it also rehabilitates lives. And it's absolutely right that members highlight the challenges that are faced in the areas that they represent, and sometimes a service that has not met the usual high standards. And every single one of us will write to our health boards, our local GPs and the health and social care partnerships on a regular basis, highlighting cases for our constituents. And if we do see a pattern developing, then it must be highlighted and also addressed. Now, sometimes, however, there does seem to be a portrayal, and we've heard it already today, particularly from the Tories, that the NHS is close to Armageddon if we listen to some of them. It is not. By talking down our NHS, it actually does not help the morale of the staff.
No, it doesn't.
It puts them under even more pressure, and on top of the extra demands that are happening to the NHS, it actually will make it harder to recruit the people into the service that we require. I've already taken two, Mr Johnson, I'm sorry. Monica Lennon's motion highlights a few things. Now, one of them being about the public inquiries into NHS Greater Glasgow and Clyde and also NHS Lothian. And it's right that the public inquiries need to happen. And it's the public deserve to know what actually has happened. I will not disagree with her on putting that in our motion. It's the taxpayers' money after all. However, if the inquiries didn't happen, then this Scottish Government would have been accused of trying to brush everything under the carpet. And on a similar note, with both health boards being escalated to level 4 and the additional measures that have been put in place to examine the areas that are clearly haven't operated as they should, this should be welcomed. Now, there were calls to put in special measures because of the concerns regarding the health boards. And if the Scottish Government didn't introduce the escalation process, they would have been accused of trying to cover up. Now, thankfully, the Government didn't do that. The Government put these measures in place, and I think that's the act of a responsible government. The aim of this intervention is to ensure that the development of a robust recovery plan is put in place that can move the boards forward to an improved position on performance and also on issues as quickly as practicable. I've already taken two, Ms Bailey, I'm sorry. Monica Lennon, she had two asks in her motion, and I have actually been to a few of the NHS Greater Glasgow and Clyde Health Board meetings that she talks about in the motion. Both the current and previous Cabinet Secretaries were actually in attendance, as were Labour politicians. And secondly, committees of this Parliament regularly bring people to provide evidence. Now, I was a member of the Audit Committee when I was first elected in 2007. And we were undertaking the inquiry into NHS Western Isles, which was an absolute basket case. And I'm sure if someone wants to do a research, they'll find basket case actually on the official report. Because at one point in time, it had 3 chief executives on its books. The one that had been put under garden leave, The one that came in to actually fix the problem, then had to get put in gardener leave, and then the one that came in to actually fix the problem. Now, in my own local constituency, I'm sorry, at my last minute, in my own local constituency, there are challenges, and I have raised these issues directly with the Cabinet Secretary and also with the Health Board. But I also welcome the positive actions that have taken place. The building of the Orchard View Hospital is a continuing care facility serving extremely vulnerable people. I also welcome the building of the new Greenock Health Centre that's taking place. That's going to be a state-of-the-art facility in my constituency. And thirdly, Inverclyde was used as a pilot area for the minor ailment service, and that's now been rolled out elsewhere. There are areas of progress locally, but also some challenges. One of the challenges being the out-of-hours GP service, and it's something I have raised directly with the Cabinet Secretary and also with the Health Board, and it's something that clearly is an issue of concern, and it is still going on, and it does need to be fixed. But certainly, the Tories in London, they could actually help fix this problem if they sort out the pensions and the overtime issue that's actually having an adverse effect upon GPs actually wanting to go and do some of the out-of-hours. Now, on the 11th of March, when the Tories have their budget, hopefully they will fix that particular problem, but I doubt it. Now, the UK government certainly have got they've got a bit of a cheek on this particular issue. This is the Tories, but on this issue, some people who are a bit more cynical would probably say that this is maybe one way of the Tories trying to downgrade the NHS so they can actually sell it off when it comes to some type of trade deal with the USA. Anyway, I am conscious of time, signing off, sir. So thank you very much, and genuinely, I will support the Scottish Government, who are actually trying to make sure our health service is fit for purpose.
Yep. Look at John Pilgrim.
Now,